Okay, hi, my name is Dr. Douglas Faigel. I'm the chair of the Division of Gastroenterology and Hepatology at the Mayo Clinic in Arizona, and I'm also the president of the American Society for Gastrointestinal Endoscopy. I joined the Mayo Clinic in Arizona in 2010. I've been there 5 years. I'm a professor of medicine. My field of interest is therapeutic endoscopy and pancreatology and oncology. And then I became the chair of our division a year ago. We're ranked in the top 10 by U.S. News & World Report. We're number 9. We're a fairly large division. We have 31 physicians on 2 campuses and 2 endoscopy units. Well, we had a number of goals. One of the very pressing things that was facing us had to do with changes in reimbursement from CMS, and that's really kind of dominated a lot of our public policy efforts this year. It began a year ago with the cuts to upper endoscopy, and now this year the proposed cuts to colonoscopy reimbursement, proposed changes in how sedation will be reimbursed in 2017, as well as some regulatory changes. Those are, I think, some of the big themes that we've been facing this year. Yeah, we had a conversation with CMS this morning with representatives from ASGE, ACG, AGA, and we had several topics that we were talking to them about. First of all, it had to do with colonoscopy reimbursement. There was a proposed rule that came out in July that proposes cutting professional fee reimbursement an average of 14%, but the range is actually up to 20% for some codes. And that's a real concern to us. We're starting to win the war on colon cancer, and the last thing we want to do is put up barriers for patient access, Medicare beneficiary access to colonoscopy. In response to that, ASGE and the other societies have been directly interacting with CMS. We organized a large letter writing program during the public comment period, and we also organized a large member grassroots effort aimed at Congress. And that resulted actually in Congress submitting a letter to CMS that was co-signed by 115 senators and Congress people, and that was really positive. So this morning, we talked to CMS about that as one of the topics, and they very much acknowledged that they had heard loud and clear from us and from Congress. We don't know what the final rule will be. That will be announced next month or early December. But we think that with all of these efforts that these cuts will not be as severe as originally planned, but we don't know what those are. I really don't. I'd hesitate to guess, but I'd be surprised if it ends up being double-digit, because I do think that they did hear from Congress and from our societies and our members. Well, if they put up a lot more barriers to Medicare patients getting appropriate screening and surveillance, I think that you're going to see a rise in the colon cancer rate. We've seen, decreases in the incidence and mortality of colon cancer. Colon cancer is an age-related malignancy, and with our population aging, we really should be seeing an increase in these cancers, but we're seeing a decrease. So it's really been one of the few successes in the war on cancer. Also, CMS putting a lot of regulatory burdens related to value-based purchasing, I think, puts a lot of strain on a lot of practices and their ability to continue to see Medicare patients. And then some proposals related to how sedation is paid for, I think also could negatively affect how we're doing endoscopy and preventing colon cancer.